So my name's Nathaniel Beachy. I'm one of the neurologists here at Norton. I specialize in neuromuscular disorders and also a procedure called EMG. I thought it was really interesting to get into healthcare, because this is such a complex field on one side and also such a personal field for patients where it's really hard to find a way to navigate that system, and being a provider I think is a good link to help educate patients so that they can be involved and help make decisions in their own healthcare. An EMG is a procedure that uses small amounts of electricity to evaluate the peripheral nerves, so nerves once they leave the spinal cord, either in the neck or in the low back, nerves that travel through the body, and then also the muscles that they innervate. So we can get a lot of information about the health of that part of the nervous system from the procedure called an EMG. And then neuromuscular disorders are the collection of neurologic diseases that come with that part of the peripheral nervous system. So the test to evaluate the function of the peripheral nervous system, and then also the clinical evaluation and management of those conditions. So we see lots of things that are more common. So we get neuropathy from things like diabetes and common problems with nerves, and that's a lot of what we see in neuromuscular disorders. We also see conditions like Lou Gehrig's disease or ALS, other disorders that affect the muscle primarily, things that we call myopathies. So there's a large condition of various diseases that affect the nerves and the muscles, the way they communicate with each other, and all of those things would fall under the category of neuromuscular medicine. It's a difficult thing sometimes to adjust to a new diagnosis. I think part of what we can provide as providers is, we've encountered these things before, and we've got some experience with how to treat, various conditions and neurologic diseases. And we're in a really exciting era where we have a lot of new therapies that weren't around even 5 or 10 years ago. And so I think a lot of times even just somebody with the experience and the expertise to help answer the questions about, what is this new disease and how do we begin a treatment plan, and to be able to make those steps together can be a good approach at the beginning when you do deal with a new diagnosis. I grew up in Indianapolis, Indiana, so not too far away. Went through school there, an undergraduate at IU. Moved out to Charlottesville, Virginia for residency in neurology, and then stayed there for a fellowship program where I did an extra year doing EMGs and neuromuscular clinic. And then we've come back out here to Louisville to settle down and start practice after training. I really like running and hiking, and so I'm looking forward to finding some places to do that here in Kentucky. I really like sports. Anything sports is easy for me, whether it's just playing in a rec league or watching on TV. That's always something fun to go to. More recently, having moved here from Virginia with our young daughter, we've been looking for the nice playgrounds in our area, and so more likely than not, that's probably what you can find me doing here this weekend.